Good afternoon again, everyone, and welcome to our Access Services Associate Program. Again, this session will be recorded, so that way if you want to review it later or share it with someone else, you'll be able to do so. Again, my name is Lauren. I'm with the WPSI team, and our team member Morris is going to be active in the chat. So definitely look there if you want to post a question, so that way you can get your answer. We will have Q&A at the end of this. So let's jump right into the agenda. Of course, we're going to learn a little bit about WPSI, the West Philadelphia Skills Initiative, Penn Medicine and being an Access Services Associate, the program schedule, and then the application process. So of course, the West Philadelphia Skills Initiative, WPSI, we design and we run programs that connect you to the tools and supports needed to build a program that is meaningful to you. We run a cohort-based training model, one employer, Penn Medicine, one position, Access Services Associate, one participant for one job opening, and then we offer professional development and also career coaching. The WPSI team engages employers such as Penn Medicine in order to understand their workplace culture, hiring practices, turnover issues, and develop a customized solution that meets their needs. We work directly with employers and participants. We're connecting employers to talent that they need and participants to opportunities that they may have never been able to access. So it's a win-win for both our employer partners and of course, job seekers such as you. So the energy that we bring to our participant relationships is the same energy we bring to our employers. Our goal is to build strong, trusting relationships. We listen to your pain points and we respond to them. We create a solution for the job, for you, the job seeker. And this is what it looks like. We study employer needs and job seeker needs. We build a customized training program to prepare participants, not only for the job at the end of the tunnel, but for your career at Penn Medicine. We reach out to the community through our email list, our social media, community-based organizations, technical schools, and any network, so that way we can connect talented individuals who are ready and willing to contribute value to their next employer. And then we make those successful matches. Our graduates connect to full-time employment where they can be successful for themselves, but also for the employer. Now let's talk about Penn Medicine. Penn Medicine is dedicated to the mission of providing the highest level of care to patients, conducting innovative research, and educating future leaders in the field of medicine. Working for this leading academic medical center means collaboration with top clinical, technical, and business professionals across all disciplines. From their website, today at Penn Medicine, someone will make a breakthrough. Someone will heal a heart, deliver hopeful news, give comfort and reassurance. Our employees shape our future each day. The Penn Medicine Access Center is the largest call center within Penn Medicine. They have over 300 employees who take over 4 million calls annually, supporting 30+ practices. The calls they handle are for any reason someone might call a doctor's office to make an appointment, update insurance, talk to a provider. Penn Medicine is partnering with WPSI to hire qualified and devoted Access Services Associates that can meet the demands of offering patient-first customer service. So now let's talk about the expectations of the role. This is a full-time position with Penn Medicine benefits, including medical, dental, and tuition reimbursement. You'll have a stable schedule. The hours can be 9 to 5, 8 to 4, 7 to 3. That's all determined by the hiring managers at Penn Medicine. but it's a Monday through Friday, and again, stable schedule. The starting salary is $17.69 an hour for prior experience in customer service and could be considered when determining a higher rate for newly hired individuals. They have a robust training program, so that way you're prepared for the day-to-day to answer your outbound calls, the access orientation program, and of course, their career pathway opportunities. Penn Medicine team really thinks about the growth of their ASAs. There's a tiered approach to promote staff to take on more responsibilities and their leaders. So Penn Medicine is really thinking about staff morale and staff growth when you're providing this patient first customer care. There are some other important things to note, definitely when considering this program, and also your application and interview through the WPSI's recruitment process. Of course, they are looking for compassionate individuals. Patients could be calling for many reasons, schedule an appointment. So we want to make sure that you're compassionate, and also patient empathy is a must. You're working with scheduling appointments, dealing with insurances, and even patients in crises. So you want to make sure you're patient focused and really showing that customer service and empathy. Patient empathy is a must. Also being computer proficient. You're going to be learning the Epic software, which is a typical software for data management across many health systems, including Penn Medicine, but you want to be comfortable and confident in navigating the computer, able to type while you're talking and answering phone calls, able to navigate between different platforms. Here at WPSI, during our recruitment process, there is a computer literacy assessment that you will take because we want to make sure you are prepared and being successful during the training process and your day-to-day with the access services team. Excellent customer service experience. Again, they're going to be working with patients, so you want to make sure you have that customer service experience, that professionalism, conflict resolution skills, problem-solving skills, quick on your feet. This is a fast-paced role. You could be taking over 60 calls a day. So you want to make sure you have that computer proficiency and then also that customer service experience. And you want to highlight that on your application. You must be interested in wanting to work in a call center environment. You must like talking on the phone. If you have any call center experience, that is a plus. It's not required, but you want to be verbally warm, engaging, and articulate, especially when you're working with these patients and scheduling appointments. And again, you might hear me repeat myself because I can't stress it enough. Solid customer service background, and it needs to be reflected on your application. This is a high pressure, fast-paced environment, so you want to be able to keep up. So that's why we're looking for individuals who are computer savvy. High school diploma, GED. Penn Medicine does require annual flu shots. So that's something you want to make sure you consider as you move through the onboarding process. They also require the COVID vaccine for all their Penn Medicine staff. So that's something that is required, and we have a date on our application when you want to make sure you submit your vaccination card. And also you want to be tobacco-free. This is the cool thing about these information sessions, because we're able to give you not only tips for your application and the interview process with WPSI, but it's also prep if you move forward, and then making sure that you're successful moving through the interview and onboarding coordination process, crossing fingers if you're hired by the Penn Medicine team. Now let's look at the program calendar to make sure that these dates fit your scheduling commitment. Recruitment for this program ends January the 10th at 5 p.m. So if you've already submitted an application and you're like Lauren and Morris, there's more information you need to submit. You want to include some more of those customer service skills and details. You are able to resubmit an application. Just make sure you email WPSI if you have any questions on where to get started to resubmit an application. If you move forward with the program, you will receive an email from us regarding next steps, which will be an interview in person at the WPSI office, meeting with either myself, Morris, and one of our WPSI team members. We'll also share with you some documents that you need to submit, similar to onboarding for any employment opportunity. Classes will start Monday, the 22nd. You'll be earning a stipend during your 3 weeks when you're in your professional development sessions with us. That's everything from interview coaching, career coaching, honing in on a growth mindset, problem solving, customer service scenarios, emotional intelligence, professional branding, you name it. Again, WPSI, we're not thinking just about the job. We're thinking about your career at Penn Medicine, your growth, handling the day-to-day, and then also creating a sense of community. You'll interview with Penn Medicine during this time, and then also during our program, you'll get a resume from our resume consultant that is geared towards customer service, patient care, directly related to this role that you're interviewing for at Penn Medicine. And of course, we'll end the program on February 9th, celebrating your success and any feedback you have from the program. And then after you graduate our program, we'll be providing onboarding support to make sure you can attend your onboarding coordination at Penn Medicine before you start at Penn Medicine being a new employee. So I want to quickly go over the order of operations so that way everybody knows all of the steps in this recruitment process. The first one is you submit an application. You want to make sure your application includes your customer service experience. If you have call center experience, worked in healthcare, you multitask, and really why you want to join the WPSI program to prepare for your career journey at Penn Medicine and joining their access team. You want to fully share your work experience and answer all those open-ended questions fully. It's all about making a great first impression, right? So we're not collecting resumes at this point. We want to hear directly from you talking about your experience, your customer service, and why you would add value to the Penn Medicine team. Then you'll come in for a WPSI interview, some assessments that we offer for classroom management, and then we'll also request that you submit some onboarding docs, right? Again, it's all about making sure that you're successful moving through the onboarding process. So having your high school diploma, if you don't have it, ordering it, social security cards, IDs. Again, we're getting you ready before you even start the program to make sure you can move through this onboarding process smoothly. Then you'll attend a participant agreement meeting. That's invite only. After you move through our recruitment process, that's an opportunity to, one, meet other members in your cohort. These are now going to be your future team members, folks that you can lean on, and again, creating that community of trust and your professional network. You'll also learn about the commitment that not only you're making, but Penn Medicine and WPSI are making. This is a collaborative effort in order for you to be successful. So we really talk through those commitments. We review the timeline with you because, again, we want to make sure that we're enrolling applicants and future participants who can commit to the timeline, be fully engaged in the program, limit all distractions, and make this time dedicated to honing in on a growth mindset and getting ready to be a new Penn Medicine employee. Then it'll be our professional development. And I ran through many of the topics that you'll be discussing during that session. And then, of course, you'll be interviewing with Penn Medicine's access team. During that 3 weeks, there's also going to be an opportunity for you to have a meet and greet with Penn Medicine as well. So the customized program that we offer is very intentional to make sure you're always making that best and great first impression when meeting with Penn Medicine team members and the hiring managers there as well. So that's kind of the order of operations. So I know I did a lot of talking, so I'm going to stop sharing my screen And now welcome our great team members at Penn Medicine for some Q&A. So no pressure yet from our audience. Of course, I have a question here. I see you, Marie. Thank you so much for joining. Hey, Chris, I see you too. Perfect, you can unmute. I wanted to make sure you can unmute. Zoom is sometimes tricky with that. So my first question, y'all, I will kick it off for everybody, just to ease into the question. For our Penn Medicine team, what does it take to be a successful ASA at Penn Medicine?
So I think, Lauren, I think you hit the nail on the head with your presentation, honestly. I think a successful ASA possesses a combination of qualities that we look for. So good communication skills, you have to be able to clearly and effectively communicate with our patients. Empathy and compassion is a big one. Again, we're, working with patients who may be going through challenging times. Maybe they just got a really bad diagnosis, or they're calling in for their family members who received a diagnosis, and they're just looking for care and compassion. Knowledge of healthcare processes is definitely a benefit, obviously not a hard requirement, but a benefit if you are understand medical terminology and hospital operations, of course. Clear attention to detail, problem-solving skills, thinking outside the box, and things like that. Teamwork and collaboration is really huge at the Access Center. We work very heavily as a team. And then obviously patience, to deal with our patients. And technology proficiency, I guess I would say.
Thank you so much for that, Marie. There we go. All right. I'll jump into a second question before we open it up to everybody. What part of the work being an ASA tends to be the most difficult for new ASAs, and how does the team provide support?
Yeah, I guess I can take that one. So I think probably the biggest barriers that we see with new ASAs is it's a complex healthcare environment, right? A lot of our practices are specialty practices, so things can be very complex. There's obviously emotional challenges to working in an environment like this when you're talking with patients all day. You're dealing with patients and family members of patients. It's a very fast-paced environment, so that is huge as well. You have to be ready to work all the time. And then the usual like learning curves and things like that. The Access Center has a really good training program. You have orientation on day one. You have a 4-day training class on our medical record system. We have mentorship programs, and then in addition to our AOP, which is a 4-week training program that we provide. We also have things like employee assistance programs, which will help people with dealing with those emotional situations that may come up. We have peer support, peer mentoring. We have team chats and things like that. So there's always support available for you.
Thank you for calling it out, Marie, and then also kind of the first week or 2 weeks of that training process too. Thank you so much. All right, I'm going to open it up to some questions. I did see one. Thank you, Kia. How big is the cohort for this program? We're looking for about 15 to 20 qualified participants for this program. Our recruitment process is very competitive. I want to call that out now. So you want to make sure you submit a thorough and detailed application that's highlighting many of the skills that Marie kind of highlighted with us this afternoon. But once you're in that cohort, there's no competition. This is now your professional network, the group that you can kind of be vulnerable with. Our director of programming, Dr. Romaine, has created a lot of activities so that it can be definitely interactive, so that way you can feel comfortable and safe in our professional development spaces. I see a question, can you use a religious exemption for the vaccine? No, not for the WPSI program. So you want to make sure you submit that COVID vaccine documentation if you are vaccinated. That's a good question. Thanks for asking. Do you have to have the most recent booster for the COVID vaccines? The last time I checked, no. Chris, do you need to have an updated booster, or is just making sure that you're fully vaccinated with the 2 doses?
Right now, the qualification is just the initial 2 doses.
Thank you so much for that.
Yep.
And of course, if it's the Johnson & Johnson, if they still have it, the 1 dose.
Right.
Thank you for that, Chris. I'm going to, here we go. Is this a remote job? Oh, thank you so much for that. This is a remote position if, right, you get signed off by the hiring and operations team, right? So you'll do your training with the Penn Medicine team, that robust training plan. You'll take some calls with the support from the training team and leaders there. And if you've received the approval, it's an opportunity for you to work remote. There will be some requirements that you need to work remotely from home. I'm going to share a few that I know here. You want to make sure you're able to work in the closed door space. Again, you're dealing with a lot of confidential information and confidential calls, have high-speed internet. Penn Medicine will provide you the tools and equipment to work. And then also either renter's insurance or homeowner's insurance as well. We get this question a lot with remote work. This isn't an opportunity where you can work 2 different jobs at once, care for a child or a loved one. You are going to be on that computer, and trust me, Penn Medicine has all the tools to make sure you are active in taking those calls, okay? So thanks for calling that out as far as a remote opportunity once approved. And as you move through your recruitment and your training process at Penn Medicine, they'll give you more information to work from home, but it is an added benefit to joining the Access Services team. Someone asks if this is a lottery pick. Oh no. Our recruitment process is set up with different assessments. And then of course, the WPSI interview. Again, it is very competitive, but we took a lot of time to really develop our recruitment strategy. And of course, we listen to our employer needs. They're looking for individuals that are confident in front of the computer and on the computer. So we ask questions and do an assessment around that. We ask about your customer service skills. We ask about your feedback, how you like to receive feedback, what happens when someone gives you constructive feedback. So you want to make sure you come into the WPSI interview similar to you going into an employer interview. You want to be ready to go and be your best self. Hold on, making sure I answered all the questions. Trying to make sure. Sorry, y'all, I'm trying to read through the questions to make sure. Could you repeat the policy?
Someone did.
Go ahead, Morris, I'm sorry.
I'm sorry. Someone did ask, could they ask a question on the microphone?
Oh, sure. Anybody can jump in and ask the question.
Wayne, sure. Wayne, you can unmute yourself and ask your question.
Okay, thank you. Hi, good afternoon. So, obviously my name is Wayne. I was wondering, I'm a college student at St. Joe's, and my aunt, she did work at Penn Medicine, and I was wondering if it's any way I can be able to do school and work at, like, in this program.
Great question, Wayne. For the WPSI program, the hours are 9 a.m. to 12 p.m. Monday through Friday. So you want to be able to commit to those hours and be fully engaged. Our attendance policy for our program, everyone is similar to an employer's probationary policy. Got to be on time, have to be engaged and active. As far as kind of school and work, I know folks are able to balance that all the time. So whatever schedule you commit to, if you do move forward and hired by Penn Medicine, as long as you can make your stable hours there and work, you'll be able to fully commit to either our program or to their work schedule. So I'm hoping I'm answering your question. So
yeah, you did answer my question.
It'll be some time management on your end, but we do have graduates from our program who participate in school. But we just made sure that we're really clear and transparent that you want to be able to commit to a full-time employment opportunity, because
Mhm.
WPSI programs are full-time and of course are classroom schedule.
Okay, I did have one more question. I'm sorry if
Sure, go ahead. No, jump right in.
I was also wondering if it's any way that like from this program, based on like what I'm studying, will I be able to get a job within like the hospital or anything like that as well?
After the question, Wayne, I want to make sure I understand it. Like the
So
degree that you're pursuing. Go ahead.
yeah, so I'm pursuing biology and sports medicine. So I was wondering, like, with this program, will I be able to transfer over to like somewhere within like the hospital, like, you know, maybe like physical therapy or something like that?
That's a great question, Wayne. So for this program, we're looking for individuals who want to join the Access Services team. So that should be one of the goals. However, I believe, and Chris, correct me if I'm wrong, after about a year of performing at Penn Medicine, you have an opportunity to explore other career opportunities and departments, Wayne.
Yep, that's right. So typically the path for any candidate really that comes into Penn Medicine is they will start in their initial position at least for 1 calendar year, so 12 months on the job. At that point, if you choose to apply to other positions, you'll be eligible for transfer. What that typically looks like is kind of a case-by-case basis, obviously depending on career goals, education, kind of making sure we're meeting those minimums. But in general, if you've been in the position for a year and you have something that you're looking to get into, that's something that we're happy to support you with.
Okay, thank you.
Thank you, Wayne, for the question, and thank you, Chris, for responding. Someone asked me to repeat the potential shifts. There's stable hours at Penn Medicine that we'll definitely discuss as far as your assigned department during the interview process with Penn Medicine, but expect to work kind of a 9 to 5, 8 to 4, 7 to 3 type of schedule. But once you get your schedule, it's stable hours. Someone asked, oh, go ahead, Naima, jump right on in.
I'm sorry for interrupting you, but
no, please go ahead.
My question was more in reference to the application process. When I was trying to fill out the application, I had trouble with the COVID-19 thing. I'm willing to get the vaccination. I know it's due by a certain time, but how do you know, like, if I don't want to get vaccinated unless I'm considered? You understand what I'm saying? So it's like I had to put yes and just continue with the application so that I could get past that initial screen.
Yeah, Naima.
So I just want to know how.
Yeah, that's a good question, but it's a hard question to answer, right? Like, we don't want you to do anything that you don't want to do, and that's why we're fully transparent during these conversations, right? You won't necessarily know your official status in the program until, hold on, let me check my cheat sheet here, until January the 16th, but our document submission deadline, I believe, is a day before that. So that's hard to kind of answer. It's really up to you, and that's why we kind of share it now before you start this process. If it's not something you want to get, then this might not be the opportunity for you. But if you do have that vaccine or you decide to get it, you can submit it to us right away during the WPSI to the WPSI email address, and that way we can attach it to your profile. So I wish I could give you a definitive answer like, hey, you're moving forward and what that looks like. But our recruitment process is very fair and consistent. So I really wouldn't have that answer for you until we complete all of the interviews, all of the assessments, and can look at all of the qualified applicants that want to move forward to the Penn Medicine program.
Thank you.
No problem. This is for the Penn Medicine team. Does Penn Medicine offer overnight hours in the Access Services team by any chance? Nope.
Yep, so our hours are pretty strict on the day shift. We follow normal business hours in the Access Center. So like you were saying, most of our shifts are going to run somewhere in between 8 a.m. and 5 p.m., depending on what specific team you'll be supporting within the hospital. So a large majority are operating between 8 and 5. So whether that's like 8 to 4:30, 8:30 to 5, somewhere in that range.
Thank you for that, Chris. And while I have you off mute, does the Access Center have federal days off or federal holidays off?
We do. So we offer for 2024, we offer 8 paid holidays per year, and we're hitting all the big ones. So it's going to be New Year's Day. I believe it's New Year's, MLK. We offer like obviously Thanksgiving, Christmas, Independence Day, Labor Day, Juneteenth. And I think there's one more that I may have missed in there, but it's 8 total federal holidays that we offer off.
Thank you for that, Chris.
Hi, excuse me. I want to speak, and I do have a question. So I did went ahead and submit my application prior, I think probably like 3 days ago, but I forgot to include a work history. Am I able to go back into the application, or will I have to just create a new application and submit it?
You would have to submit a new application and make sure you include that. Also send an email to WPSI just in case if you run into any issues, so that way we can troubleshoot on the application level too. So no, we want to make sure that if you've already submitted an application, but that's why we have the info session. You got these great tips you're hearing from the Penn Medicine team. Feel free to submit another application. If you run into any hiccups, feel free to reach out to the WPSI team. Morris is quick and responsive to make sure we get that better application reviewed by our WPSI team members.
Okay, another question. I did remember you mentioned the benefits of the position, just in case we were let's say we were considered, or I was considered, move forward into that position. Or does the position offer PTO? Or I did hear you list a few benefits that come with the position. Does it offer PTO?
I'm going to say yes, but I'm getting some head nods from the Penn Medicine team. Absolutely. Great question. Thank you so much for asking.
Does the position have a 401k? This is Gina. Hello, everyone.
Hey, Gina, how are you doing?
Good. I have call center experience. That's kind of what I've been doing for the last, I don't know, 7 years of my life. But does it have a 401k? Stock options?
Yep. So we do have retirement matching. Marie might have to correct me if I'm wrong, but I believe it's 403B, which is it's a 401k, just the not-for-profit version. So same thing.
Okay. Thank you.
Great question. Thank you for that. Someone asked where is the Access Center located if you have to go to the building. Good question. The Access Center is located at 1500 Market Street. Somebody already answered that. Thank you, Alyssa. Teamwork makes the dream work here, y'all. All right. Someone asked about what are some steps after this. So this is just a good time for me to kind of go over some key dates again. Let me get my cheat sheet. So
Let me ask you start.
Go ahead. No problem. Go ahead.
Sorry, I do apologize.
No problem.
So when training starts, will it be via Zoom or will it be in person?
Great question. Now for the WPSI program, our 3-week professional development program, you'll be via Zoom. So you'll be on Zoom 9 a.m. to 12 p.m. For the Penn Medicine schedule, I believe it's a blend of hybrid, but for that EPIC training, that'll be in person, correct? I see Marie come off mute.
Yeah. So the first week is mandatory on site. So it is your new employee orientation, and then the EPIC training program is on site that Friday. Generally, as long as you provide all of the proofs that we need to allow you to work from home, we'll give you your equipment, and the rest of your training will be at home. There are some cases here and there where we keep people on site a little bit longer, but generally, if you pick up the information and there's no behavioral issues during that first week and things like that, you're set to go home that first Friday.
Thank you.
Thank you. Someone asked about the interview. The interview will be virtual on Teams, and a great thing about our program is some of our activities will be on Teams, again, to prepare you for getting ready for Penn Medicine. So you'll definitely prepare for that interview, including a resume that reflects your customer service experience and some mock interviewing as well. So we'll definitely get you busy and confident before that interview. Someone asked if they could submit if they have an expired driver's license. You can use that when applying, but we're going to call it out to make sure you go take care of that, so that way when you start your onboarding at Penn Medicine, you have your license. So great question. For us, it's definitely verifying your address. That's why we use the ID. Our programs are for individuals who live in Philadelphia. So I want to make sure I call that out. Over 18 years old and live in Philadelphia. Someone asked if it's a program of school and work experience. You want to make sure, and I'm hoping I'm answering your question, Timothy. For your application, we do request you list your educational background. So if you have any school, of course, listing your high school diploma, GED, that's a requirement. But if you have any additional college experience, even if you didn't graduate, that all counts. Any certifications or licensing you have, or any educational highlights, that all can be included on your application. And of course, that customer service background, your professional experience, you want to detail that out too. So I'm hoping I'm answering your question. Sometimes folks say, hey, I have my resume. We're not looking for resumes as part of the application process. So you want to make sure you really spend time to write out all of that work experience and that professional experience for us. And we answered this one, but I want to share it again before I jump in for our next steps and kind of some key dates. If you would like to resubmit an application, you're able to do so. Please reach out to WPSI. Morris is going to drop that WPSI email again, just in case if you run into any application issues. Star WPSI's email, so that way you can see notifications, and if you need to email us, you can get to us quickly. The stipend amount, thank you, this is a great question too. For your 3 weeks in professional development, WPSI offers a stipend of $150 per week, and you'll receive that for participating in our program. So it's one of the benefits for being engaged in working with us. Thanks again, Morris, for the written follow-up on that. All right. So now I'm just going to jump in with some next steps, so that way everybody has it. You still have time to apply or share this with anybody who think might be interested in the program. Wednesday at 5 p.m. is the deadline to apply for the ASA program, with all of the great tips that we shared this afternoon. If you move for it, you'll hear from us to schedule an interview at WPSI. If you have any documents, if you move through that process, and you have any documents that you need to submit, you want to do so by Monday, January the 15th. You'll know your status in our program and receive an email from WPSI by Tuesday, January the 16th, and be prepared for an invite-only participant agreement meeting / meet and greet, Thursday, January the 18th, 9 a.m. to 12 p.m., and classes will start January the 22nd to February 9th to get you ready for your interview with Penn Medicine. I want to first thank our Penn Medicine team for joining us this afternoon, and of course, for the great partnership that we have, and of course, all of our applicants who are here. Good luck in the recruitment process and application process. There's always a question that comes up after I finish my outro. For the Penn Medicine team, what is the pay cycle for Penn Medicine? I believe it's bi-weekly. Yes, I passed the test. So Yvonne, that's a bi-weekly pay. Great question. If you have more questions, please email the WPSI team. We work 9 to 5. We'll be able to respond to you during those hours to make sure we answer all of your questions. We are active on social media, so you can always drop questions there. Our team member Fontaine will respond to you and let us know if there's anything that you need. Thank you again for this afternoon and spending this hour with the WPSI and Penn Medicine team, and good luck. If you're looking for the recording, it'll be on our website too. Great question. All right, everybody, I'm gonna close that down.
So before we go, so the recording is going to be on the website. Are you guys going to be able to email